Hello, I'm Dr. Arlene Donar, and I'd like to welcome you to my home office here in Washington, D.C. I decided to do a video because so many people have questions about naturopathic medicine, sometimes as fundamental as what is a naturopathic doctor. So why don't we start there? Naturopaths graduate from four-year medical schools. We receive training in allopathic medicine, that is being trained as a primary care physician. And then there is the naturopathic piece, and that includes extensive training in botanical medicine, homeopathy, clinical nutrition, oriental medicine, physical medicine, and of course counseling, because you cannot discount the importance of the emotional and physical component of healthcare. You might notice as you look around the country that naturopaths have a different scope of practice from state to state, depending on the licensure in that particular state. Here in Washington, D.C., I'm licensed to work with all natural substances, and I have prescriptive rights for bioidentical hormones. So that often leads to the next question, which is, well, if you work with natural substances, can I work with patients who are currently taking prescription medications? And the answer to that is absolutely yes. Many patients who come to me are not only on one medication, but on multiple medications. I work with them to make their bodies as strong as possible while on the drug, and also to work with the inevitable side effects that these drugs produce. I also have patients who are undergoing cancer care and possibly having chemotherapy. There we work to enhance their own body's immune system, their own body's health, so that they can work well with the chemotherapy treatment, and also to reassure the patients that whatever I am recommending will not negatively impact the goal of the chemotherapy treatment. I have patients who are healthy. They want to stay healthy. So they come to me a couple of times a year to have a tune-up, a medical tune-up, make sure they're on the right track. And then there are those patients who are sick. Maybe they haven't felt well for a long time. Have they received a diagnosis? Maybe it's the wrong diagnosis, or maybe the doctors just have not been able to help them. So we will work together to see what the root cause is of this illness. Usually that will involve laboratory work so that we can rule in and rule out health conditions that we can focus on. I work with an adult population, people 40 and older. Generally that's the time when we see health conditions arising that we haven't seen before. We will focus on hormonal imbalances, weight gain, osteoporosis, high cholesterol, high blood pressure, sugar imbalances, autoimmune diseases, the cancer care support that I talked of earlier, and a number of other issues that I haven't mentioned. So you have learned maybe a little bit about my naturopathic practice, a little about me as a naturopathic doctor. So now it's my turn to learn about you. So I invite you to call the office, set it up an appointment for initial consultation, and we can start working together.